Live with Bridget Ellison, Julie Broughton, meteorologist Candace Campos, and traffic safety expert Trooper Steve. This is News 6 at 9 a.m. Getting results.
Helping sick patients is top priority for any doctor, but yearly appointments allow for patients to learn about preventative care and becoming more educated about their own health.
Yes, at some point in their lives, a woman has their first visit to the gynecologist, and for parents of teen girls, that question of when teens start seeing an OBGYN might spark some uncertainty.
So to help with that, News 6 morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
And this is exactly the question that we created this segment for. I'm so glad that you're here with us today. And the ideal age for that first gynecology appointment can vary. There are lots of factors to consider. So Dr. Jessica Affont, an OBGYN with Orlando Health Physicians Associates, is here with us today to talk about the timing, because we just asked everybody in the studio if they knew when you're supposed to go in for these preventative care appointments. And we got 3 different answers, right?
Yes.
So let's talk about that. When should we be having that annual exam?
So you should definitely be having your first annual exam no later than the age of 21, and that should occur every single year. We will start seeing a gynecologist as early as 9 or 10, or when you start having menstrual cycles, and it's really individualized.
Yeah, so as a parent of, as a daughter, if you aren't sure, you can have that appointment really early. You can start to talk to an OBGYN about your daughter's health. And what do those appointments look like?
Those appointments usually are just talking and getting to know each other and making the female comfortable with the doctor and comfortable with the visits. They do not have to get undressed. It's mostly just conversations. I
know a lot of women are familiar with that pap smear, and when they should be having that is a big question. Some people say, oh, it should be yearly. Some people say, oh, it should be 3 years. What do you tell your patients?
So pap smear screening is actually age-based. So between the ages of 21 and 30, it only has to be every 3 years as long as it's normal. And after the age of 30, you can go up to 5 years as long as it's normal.
And if you don't have a normal pap smear?
You need to have it every year.
So that's where I think people get a little confused.
Yes.
It's like, well, I didn't have it correct for 3 years and then it changed. But I assume you have lots of patients and lots of conversations with your patients, and you'll be able to explain to them why they're coming in, every year or every 3 years.
Exactly, and it's important to know that even if you don't need a pap smear every year, you should still be seeing a gynecologist on a yearly basis for an annual exam. There are still other things that need to be discussed and examined, for instance, breast care.
Yes, so, okay, that's, again, we're gonna have to kind of take a step back here. You hear that it's every 5 years. You think, okay, I've made my, annual, but you still need to go the next year.
Correct.
For those preventative care, like you said, for breast cancer.
Yes.
Okay, so what are those appointments going to look like without the pap smear?
So without the pap smear, again, it's going over your history, it's making sure that everything is normal, and then you're still going to have a full physical exam from head to toe.
Okay. Now, let's go back to the parents. For parents who are trying to make this conversation easy for their child, how young is too young to bring your child in to see an OBGYN?
So I think it's dependent on each individual and what they have going on. Usually we don't start seeing people until they're hitting puberty, and then depending on how comfortable their pediatrician is with dealing with their issues, then coming in and just having education and talking is important.
And we talked about having a conversation with a pediatrician versus an OBGYN. Can a pediatrician give a child birth control, for example, or what types of medications are going to be different when they come to see you?
Absolutely. So a lot of pediatricians will treat young women for things that are causing problems, and they can give birth control, but usually if it goes beyond their comfort level, they'll start referring to a gynecologist.
So you can issue that and make that decision with the parent?
Yes. Yeah.
Okay, so for a parent, if they're not entirely sure if their child needs to come see an OBGYN, maybe their child is sexually active, maybe they're not, and they're just trying to figure that out. How do you have those conversations with kids?
So when we see the children in our office, we usually will have a conversation both with the parents, and then we also ask the parents to leave. It gives young women an opportunity to ask questions and just be educated more than anything. So even if they're not sexually active, it starts opening up a communication role so that we can build trust and confidence for when they do need somebody and have more questions.
And once they are sexually active, is that appointment timing going to change for the child or the parent?
So usually we start screening for infections once somebody is sexually active, and that should be done on a yearly basis.
Okay, so a lot of things that have changed over the years.
Yeah.
What would you say is the number one question that you get from your patients? Maybe a misconception that they have about these preventative care appointments.
I think that the pap smear question of don't I need a pap smear every single year? And as technology has changed over time, we've changed our screening guidelines. So you can do it more frequently than what they recommend, but you don't have to.
And is that something that's covered by insurance?
It's usually covered by insurance, but we always kind of give the caveat that if you're doing it more frequently than the guidelines, there is a chance it could be denied, but usually we don't see it denied.
All right, Dr. Jessica Affont with us. Thank you so much for
absolutely.
coming in and answering my plethora of questions there. I'll send it back to the ladies at the desk.